Hello everyone, and welcome back to my channel. Thank you for joining us today. We're excited to dive into an intriguing subject that brings together elements of herpetology and environmental science: calcium gluconate snakes. Calcium gluconate snakes, often referred to as a species within the broader category of colubrid snakes, are not a widely known type but serve as a fascinating example of ecological adaptation. These snakes are characterized by their unique relationship with calcium-rich environments, which influence their dietary needs and habitat selection. In the wild, calcium gluconate snakes typically inhabit areas where they can access calcium sources, such as limestone hills, rocky outcrops, and environments rich in soft-bodied prey that are high in calcium content. This is crucial for their growth and development, particularly for maintaining strong bones and bodily functions. Today, we'll explore their biological significance, ecological roles, and the conservation challenges they may face. So, let's slither into the details. The term, calcium gluconate snake, likely refers to calcium gluconate used as an antidote for snake venom or its role in treating specific symptoms caused by envenomation. Calcium gluconate in snakebite treatment. Calcium gluconate is a calcium supplement that is commonly used in emergency medicine to treat calcium deficiencies and certain toxic exposures. In snakebite scenarios, it can be helpful in treating hypocalcemia. Low calcium levels or symptoms associated with venomous bites, particularly when neurotoxins or hemotoxins in venom affect the heart or muscles. For example, some snake venoms cause muscle paralysis, which could affect the muscles controlling breathing or heart function. In these cases, calcium gluconate may be used to stabilize the patient's heart and muscle function. However, the primary treatment for snake bites is usually antivenom that directly counteracts the venom's effects. Calcium gluconate is more of a supportive treatment in specific situations rather than a primary cure. If you're referring to something else by calcium gluconate snake, feel free to clarify. Calcium gluconate is a calcium salt used in a variety of medical settings to address issues involving calcium deficiency and certain types of poisoning. Here's how it works. How calcium gluconate works. 1. Restoring calcium levels. Calcium gluconate replenishes low calcium levels in the body. Calcium is essential for normal muscle and nerve function, blood clotting, and maintaining strong bones. It's especially important for the proper functioning of the heart. 2. Calcium's role in muscle and nerve function. Muscle contraction. Calcium ions are critical for muscle contraction. In situations where there's a deficiency, muscles, including the heart, may weaken. Calcium gluconate helps restore a normal muscle contraction. Nerve signal transmission. Calcium is also needed for the transmission of nerve impulses. Without enough calcium, nerves can't send signals properly, leading to issues like numbness, tingling, or muscle spasms. Calcium gluconate can help alleviate these symptoms by normalizing calcium levels. 3. Antidote for certain poisonings. Hyperkalemia. High potassium levels. Calcium gluconate is used in cases of hyperkalemia to protect the heart. Excess potassium can cause dangerous heart arrhythmias, and calcium gluconate stabilizes the heart muscle's electrical activity. Hydrofluoric acid poisoning. Calcium gluconate is an antidote for exposure to hydrofluoric acid, a highly dangerous chemical. The fluoride ions in the acid can bind to calcium in the body, leading to severe hypocalcemia and tissue damage. Calcium gluconate is used to bind these fluoride ions, reducing tissue damage and restoring calcium levels. 4. Cardiac protection. In emergency settings, calcium gluconate is often administered to stabilize the heart in situations like severe hypocalcemia or hyperkalemia. By increasing calcium availability, it helps protect the heart from potentially life-threatening complications such as arrhythmias or cardiac arrest. 5. In snakebite treatment. As mentioned earlier, calcium gluconate can be used in the treatment of envenomation if the venom affects muscles or nerves, potentially leading to muscle weakness, paralysis, or cardiac issues. Its ability to stabilize calcium levels helps protect against these effects. Forms and administration. Calcium gluconate is typically administered intravenously. 4. in emergency situations, like during cardiac events or poisoning. Orally for treating long-term calcium deficiencies. Side effects and risks. While calcium gluconate is generally safe when used correctly, potential side effects include hypercalcemia, excess calcium, which can cause nausea, vomiting, confusion, or abnormal heart rhythms. Injection site reactions, particularly with for-use, such as pain, redness, or swelling. In sum, calcium gluconate is a versatile medication that plays a critical role in emergency medicine for calcium-related disorders and certain toxic exposures. You're asking about the use of calcium gluconate in snakebite treatment. Its dosages follow typical guidelines for calcium gluconate used in medical scenarios, depending on the symptoms being treated. Common dosages for calcium gluconate in snakebite treatment. Calcium gluconate is used as supportive therapy in some snakebite cases where the venom affects muscle or heart function. Here are the dosages for such situations. 1. For muscle paralysis or neuromuscular complications, caused by neurotoxic snake venom. Intravenous, for adults. 1 to 2 grams of calcium gluconate, administered slowly over 10 to 20 minutes. This dose can be repeated every 6 hours depending on the patient's response and the severity of the condition. Children, 60 to 100 milligrams per kilogram per dose, administered over 5 to 10 minutes. This can also be repeated as needed. 2. For cardiac issues, caused by venom-induced hyperkalemia or arrhythmia. Intravenous, for adults. 1 to 2 grams, 9.3 to 18.6 milliequivalent of calcium, administered over 5 to 10 minutes. This can be repeated based on the patient's calcium levels and clinical response. Children, 60 to 100 milligrams per kilogram, infused over 5 to 10 minutes. Administration frequency. Acute situations, calcium gluconate can be administered as a single dose but may be repeated every 4 to 6 hours depending on the patient's calcium levels and the severity of the snakebite symptoms. Monitoring, continuous monitoring of heart rate, serum calcium levels, and overall response is crucial when using calcium gluconate in snakebite cases. While calcium gluconate is used to manage symptoms like muscle paralysis and heart issues, antivenom is still the primary treatment for neutralizing the effects of venom in snakebite patients. Calcium gluconate is considered a secondary treatment for addressing specific complications caused by the venom. Amazing viewers! If you've had any experiences with calcium gluconate or encountered a snake while using it, we'd love to hear your stories. Drop your thoughts in the comments below. Your insights could really help someone else. And if you enjoyed this video, don't forget to give us a thumbs up, share it with your friends, and subscribe for more fascinating content. We appreciate your support, and can't wait to bring you more exciting topics. Thanks for watching.